In the Fong psychiatry service, we see patients from young adults to senior. The more common ones are depression disorder, anxiety, acute stress reaction, adjustment disorder, post-traumatic disorder, schizophrenia, and bipolar disorder. From community, we encounter more clients with interpersonal issues, family dynamic issues, and grieving, parenting, housing, and financial difficulty issues. As a case manager, I work closely with a multidisciplinary team to assist patients and also coordinate the care within hospital and in the community services based on the need. Okay. In the hospital, we have a multidisciplinary team dedicated to care for people who have mental conditions. In this team, we have medical doctor, psychiatrist, psychologist, pharmacist, medical social worker, case manager to deliver the care to people who have mental condition. During this difficult time, a lot of administrative staff and also operational personnel also treat in a lot of effort to make sure the care has been carried out and also has been well taken care of. Yep. During this difficult time, our mental health team continuously to reach out to the community to provide necessary trainings and advice, such as to GP partners, nursing home, social services agencies. At times, people may have some misconception about what is psychiatry service, what is psychological service. Maybe let me explain here a little bit more. Psychiatrists and psychologists, their goal is the same. They want to improve people's mental well-beings. However, for psychiatrists, they are medically trained doctors, so they use medication and medical procedure to improve people's mental health beings. For psychologists, they are more interested in people's how they think, how they feel, and how they behave. So they use verbal therapies and also behavioral therapies to address people's underlying issue, help them to process the issues and move on more meaningfully and healthily.
I think some tips I can provide is in terms of solo activities, right? Because of the pandemic, there's a lot of things actually online. So you can pick up skills, you can also cultivate a hobby, or even listening to more motivational talks. All these can be found online. But of course, continue to stay active and also have a balanced diet. This is also important. This is for solo activities. But we also know that humans need interaction. So continue to stay in touch with your friends, family, people who you trust. Share thoughts and feelings so that you're not alone. Because this notion of I'm not alone is actually very important and can be very powerful. On a larger scale, there are also many volunteering opportunities. There are also people who find meanings when they contribute to a good cause. Because all these activities, volunteering opportunities, give us a purpose, help us to refocus our purpose of life. And due to the pandemic, in fact, there are actually now more online volunteering opportunities. Now with all this, if you still find it difficult to cope, there are also professionals in the social service agencies who can provide you counseling or listen to you to address your mental health problems. And if you do need to see a doctor, you can go to polyclinics or selected GPs because they can help you to assess your situation and provide you appropriate treatment. Fortunately, the public mental health literacy actually has improved over the years in Singapore, but stigma is still there, which is why more campaigns to address stigma as well as ongoing psychoeducational programs to continue to raise awareness, to increase knowledge of mental illness is still necessary. Another thing is that the number of professionals in a community setting who are equipped with adequate knowledge and skills to help people with mental health issues has also increased over the years. Now this is very good news because it also means that accessibility to mental health resources is now faster as well as easier. Still, at the end of the day, prevention is still better than cure. So efforts from various platforms and agencies to promote mental wellness is also necessary. because if people can start taking care of their mental health on a day-to-day basis actually, then the chance of developing mental illness is likely to be smaller and it can also be prevented.